Okay, so today we had 4 tasks that we did in the simulation lab as a group. The tasks were placing an NG tube, a secondary IV line, trach care, and trach suctioning. Okay, so how would you say that it went today? What do you feel went well, Gia?
Well, I performed the hanging the secondary IV. I thought I did, the first thing I did well was looking up the med, seeing how fast it can be infused and whether it's compatible with the primary bag.
Right, that was very good. Thank you. Okay, and Tina?
I think my topic that we did the best was infection control. It was more about like grasping the concept of what procedures were clean and which were sterile. I did the placement of the NG tube, which was a clean procedure, and the reason for it was because it was going to the stomach.
Right.
So it was just clean.
I think we had really good teamwork. We all were helping each other without overstepping any boundaries, and we were able to ask each other questions and get everything done.
That was very noticeable that you were working together and helping each other. It was excellent. Yes. And what would you say, Megan?
I think just remembering how to figure out the placement of the NG tube. You know, listening to sounds, checking pH, doing it with an X-ray. I thought that was good remembering.
Very good. Okay. So, how would you say that your team decided the task priority sequence for today's exercise?
Well, out of all the tasks, we decided that suctioning the trach would be the best idea because we really wanted to make sure that the airway was clear so that our patient could breathe.
Excellent.
It was also like a lot of common sense thinking that we sometimes overlooked, like the 2 trach care items we did together because you're not going to suction it. You're going to want to suction it and then clean it, not the opposite. So it was just a learning process that way.
Excellent. Anybody else? Anything else you want to add? No? That was excellent. Okay. So if we were to do the same tasks again in another situation, if we were to repeat this scenario, what would you do differently? Any thoughts? Gia?
Just be a little more prepared. Now I'm way more familiar with setting the IV pump. I just was a little confused as I think I focused too much on the actual order of the antibiotic rather than the volume in the bag. So I think that's more to be prepared for.
Right.
Also probably realizing that all these tasks, these orders were assigned to one nurse, not all of us.
Right.
So realizing that we're going to be the one nurse that's going to have to prioritize each task, so the speed and efficiency of each.
Excellent.
I definitely agree with that.
Okay. Anything else? No? Okay. So, did you learn anything new today during this exercise that you think you'll take into your practice as a new nurse? And we'll just go around. This will be the last question. We'll just go around and think of something, one thing that you could take away from today's exercise into your practice.
You know, same thing with the IV, just being able to set the pump the right way and also making sure that you're infusing it at the right rate and making sure that it's compatible with what you already have home.
I would just say that today just reinforced the importance of being able to prioritize as a registered nurse. I think it's important to know what you can do and the fastest you can do it while ensuring the safety of the patient.
Right, and that's where the critical thinking comes into play, and critical reasoning, and yes, excellent.
I think today was good practice because we've learned all this stuff, but we only get 1 week to practice it, so it's nice having another chance to practice everything. I think today I would take away. I did the trach care, so it was just learning how to go from clean to sterile and what exactly what had to be what.
Right. And how did you feel about the maintaining the sterility? Was that a challenge? Did it feel like it was a challenge? Or?
Not so much.
Okay.
Yeah, no.
Okay.
I just had to remember that it had to be sterile.
Right, right. Okay.
I think definitely technique of the different tasks that we had. Like, you know, just as simple as, you know, putting on sterile gloves, you know. Are you going to do that first? Are you going to do that second? Are you going to wear clean gloves going into sterile, you know? And also with suctioning, like making sure it's always upright so you're not going to contaminate the sterility, or even your gloves, having everything above your waist. I think technique was definitely something I would
Yes.
It's a big thing.
Yes. Okay. Well, I think today was a great learning experience, and I think all 4 of these tests you'll do time and time again as registered nurses. So I hope that this was helpful, and I thank you for coming to the debriefing session.
Thank you.
Thank you.
Okay.